To get this going, call this to order. All right. Secretary, roll call.
Okay, Dutchess County, Nicholas Trio, present. Dave Violante.
Here.
Joan Siebert. Tim Murphy. Dee Sagendorf.
Yes.
Guy Carpico.
Yes.
Orange County, Joanne Cheney. Ben Conquest.
Here.
Dave Grass.
Here.
Israel Knobloch.
Here.
Terry Barbie. Frank Castnight. Michael Bigg. Putnam County, Robert Cuomo.
Here.
Dave Jacobson. Matthew Biondi. Rockland County, Kim Lippis.
Here.
Nick Rusieski. Tim Egan.
Here.
Desiree Leone. Glenn Albin.
Here.
Teresa Hamilton. Neil Dayan. BJ Leidner.
Here.
Sullivan County, Albie Bachman.
Here.
Greg Tavermina. Neil Mehta.
Here.
Heidi Stack. Mike Bruce. Mark Strauss. Ulster County, Richard Parrish.
Here.
Kelly Nelson.
Here.
Dorothy Balin. Timothy Mitzel.
Here.
Lisa Servino. Chair, Mr. President, we have 18.
18, that's a quorum.
Yes, sir.
Thank you. All right. Minutes are distributed. Any additions or corrections to the minutes as distributed? If not, oh, I did. Somewhere in this stack. On page 12, line 16, I think has been added to the marrow. It's marrow, M-A-R-O, not like bone marrow. It's, all right, the initials. And we'll be working with Rich Robinson, so it's the marrow office. Otherwise, it's the only thing I picked up. So, need a motion to accept the minutes as amended.
Second.
All right. President's report, I got one notification of an agency that had a narcotics diversion. They addressed it appropriately, and right now, that's all will be said about that. Okay? Treasury report, Nick? Or
Well, I have his report. Since our last meeting, which was November 28th, we wrote 53 checks for a total of $23,281. Two of the largest ones were for our insurance, which was $4,500, and for our audit, which was $6,300. We've done a few transfers on payroll, two of them, $30,000 each, and one in December and one in February. And we transferred $990 from the program agency account to the educational account for the CLI class, and we have $240 in the program agency account that will be transferred very shortly for the CIU class. We have vouchers in second quarter voucher for program agency was billed on the 31st and paid in early January, and the third quarter council was billed on the 31st and also paid in January. The conference and education account, which is where we pay the instructors for our classes, we wrote 10 checks, and we transferred in the money, the $990. We're going to do the $240. So that will offset the $1,102 that we paid on the instructors. And the annual audit is completed and can be viewed in the REMSCO office if anybody's interested. And that's the treasurer's report.
on the audit, were there any recommendations or anything? on that?
Some of the policies, they wanted us to do an internal funds transfer policy, that should be written, it's on here, I don't know, I haven't heard anything with that. I don't think there was anything that was really outstanding.
No, I didn't see it, okay.
No.
Okay, thank you. Okay. Might as well keep going. Regional
Okay.
staff.
Regional staff, there were 2 ALS upgrades that were submitted to the office. We processed them and went through the REMAC. It was for Village of New Square in Rockland County and Alamo doing business as Vassar EMS in Dutchess County. An update on the New Windsor expansion of territory into Cornwall. As you know, the CON was appealed. It has been submitted to the New York State ALJ's office, and there has been an ALJ assigned to it. So from what I understand, that means it's moving along in the channels, appropriate manner. And hopefully, when I was talking with them, they said that we might be able to see some results at the September REMSCO meeting. There was no promise on that, but a possibility. Our transportation committee was tasked with with Gardner Rescue Squad transfer of ownership from the Gardner to the Gardner Fire District. This was an action that will be coming in for a vote later on. Program agency was asked to submit vouchers for January and February. Instead of doing January, February, and March, they want us to do January and February, and then March separately for both the program agency and for the council. So instead of doing it 4 times a year, they're asking us to do it 5 times a year. I did do it. It's a little bit more work and a little more complicated, but the whole intent is for them to get the money that they pay back to the council and to the program agency in the proper fiscal year, so that we can get the proper money for the Bureau of EMS, so that everything falls in properly. So they're gonna try that this year. We'll see how that comes out. The office has agreed with Toro College in Middletown to accept 2 interns that are going to be working with us and doing some research with us. They'll probably be on a weekly basis, 1 day a week. They'll do a lot of work from remotely. Every month I have a call with Ryan Greenberg. It's a call with all the program agencies, and I have a summary of some of the stuff that was here. Some of it we'll be talking about later, but some just want to touch on. The Bureau of EMS did the law that lowered the EMT age to 17 has been passed and is a valid law, so you can be 17 years old and be an EMT. The Bureau of EMS is starting to move all their forms to an electronic base, and they're going to set up emails where you would email those particular forms in. All the field reps that are doing inspections will be working on laptops, and the results will be mailed to the organization. And the first day of EMS week, the Bureau of EMS is asking everybody to participate in the community outreach. And they're asking all agencies to plan events that get you out in the community, trying to educate the community about EMS. Now, supposedly they have an intern that is working on that and is going to be sending out some information on it, including banners and other things that we might be able to use in that aspect. In the February meeting, we talked about pediatric emergency care coordinators throughout the state. There's a grant that they received for that. I think maybe later someone else will speak a little bit on that. The collaborative protocols and the BLS protocols have not been signed as of yet by the commissioner. They're ready to go. They've been approved by REMSCO. They've been approved by REMAC. They just have not been signed by the commissioner. They expect that to happen within this month. I don't know if any of you people know Michael Taylor. He worked for Bureau of EMS for a while, moved on to a different organization, and now is back at the Bureau. All course sponsor renewals have been sent out. And I guess that's all I have.
Bill, the age 17 for the EMT, have they come out and anything in writing on that, or is that still all verbal?
We did, it's all verbal, but it is the law. we did speak to him about it, and he said that he will come up with something and distribute it. Now, I don't know if it will be a policy or a procedure.
I'm doing some policies internally, it's up to the agencies.
I lost you, Kim, I lost you, sorry.
It's up to the agencies in developing their policies for the state, so it's better to have something in writing to develop from than verbal. When I called, they said the 9th was, January 9th was the official date.
Right, that's when the law was signed in
But
and
we
went
need
into
something in
effect.
writing, because it's a big change to,
A lot of people are asking for it, and we did bring that up at the last meeting, and he did say that he will put something out, but I have not seen it as of yet,
I was just curious.
and I'll mention it at the next meeting if we don't have something.
Thank you.
That's all I have.
Any question? Yes,
To,
Tim?
Bill, you said mailed with the inspection reports, I think you meant email, right?
Yes, they'll be emailed.
And the
Yes.
second thing is, you said Mike Taylor's back at the Bureau. Do you know what he's doing over at the Bureau now?
Yeah, he's working in the administrative offices with Lynn, who took Tom Behannon's position. The only reason I know that is because he just recently sent me the request for budgets. Yeah. He's been back probably about a week, maybe a little bit more.
Okay. QA/QI?
Work progresses fairly well on the transition to NEMSIS 3.4. We had a conference call today with the state and all of the New York State approved vendors. And the agreement is all current agencies will be on the 3.4 platform at the close of business 12/31/19. And then on 1/1/20, we start the transition work for 3.5. The move to 3.5 is not really going to be anything dramatic. It's going to be a lot of deprecation of some of the fields that are out there. Not a real reduction as far as what we see from the field user doing the input. Just a way to break up some of the information to make it a little bit more usable. We have been working diligently on all the validation rules, and there are a couple of rules that we have spent more hours than I want to really think about to make them work, and we still have not gotten a real tight solution. And they all go back to vital signs and the stroke score and the number of vital signs that are required. One of the issues that we have is we need to make sure that the program is working within the parameters of the protocols. So we can't limit to just one set of vital signs, because what does it say in the protocols? And if we do a scan on that, then we're going to have a lot of protocol deviations. And for collecting good hard data, that is simply not acceptable. So we're working on a solution that is going to fit the BLS, ALS, FR people that are out there, the transition to another form of care. We also have to look at how long it takes for a provider to get to the side of the patient. So if you're entering a facility, sometimes it's going to take you, 3, 4, 5 minutes to get into the facility and then to the patient's side. So there are other parameters that we have to take into consideration to make these rules work. Once they work, it's going to be, I think, an exceptional system with a lot of usable data. Once Rockland Paramedics comes on board with EPCRs, which shouldn't be too terribly long now, we will be at the point where we have 32 agencies that are not using electronic, which will represent only 2.5% of the data that we collect. And that will be about 5,000 to 6,000 paper PCRs per year, which is down significantly from what we used to collect, which was in the hundreds of thousands. That's where my time has been.
Question for this?
Yes.
I read recently there are 330 rules in the 3.4 rule set, correct?
Actually, if you roll in the state and the local, there's more.
Yeah. Do you know where we are right now, offhand? I used to know, but I don't remember.
We're at around 500 total rules.
No, I mean, with NEMSIS 2.
Oh, with NEMSIS 2? I think there's like 150 rules.
Yeah, I thought it was a little more than that.
Yeah.
That's what happened.
But the number of data points in 3.4 is substantial. And what we have been working at doing is eliminating the null fields so that you can't move through a field without putting something in there.
That's right.
We have a substantial rule set with RMC right now, and then we're collecting that patient side time, for example, for years now.
Yeah.
And I'm sure you guys are too. There is going to be a lot of this information.
It's going to be extraordinary once it's done, but yes. And the robust QA/QI that an agency can do, it's going to move beyond the, did you get the patient's name, address, date of birth, and social, and into usable data so you can actually look for trends. And you can time it over a matter of weeks, months, and see where things are shifting, and see where education needs to be added.
This is where medicine is going, from top to bottom. I mean, big data, you read about Google, investing billions of dollars into looking for trends in care and outcomes. And the only way you can do it is by having big data like this. And so it's great. 98%, 97.5%. So it's almost there.
How important is that social security number? Because we go to...
It's important for billing, but that's not a NEMSIS required field. It's not a state required field.
Okay.
And we don't make it a local rule.
Because a lot of people say, I'm not giving you my social security number. So.
Yeah.
If you're a billing agency, you have ways around that.
Well, I'm not billing. That's going to a different agency.
Yeah.
And for billing it's important, but for medical research, which is, like what, the real interest, it's just the big data. It's a body with an identifier. So the fact that you don't have a social security number doesn't matter.
If any counties have agencies that need some assistance getting the EPCR, there is an opioid grant, came through the health departments, and one of the slides was to enhance the EPCR or complete it. So for Rockland, we're working with the last 3 agencies to assist them in getting on board. There's a significant amount of money, and the way it has to be spent is so convoluted. This is an easy target for that in funds. I'm not saying it's open right now because I believe it's towards the end of the cycle, it ends in June, but I believe the next cycle would also have that. And the problem is a lot of people don't communicate with the health departments. And the health departments aren't aware of EMS needs, so it was kind of a good blend for us.
So that's the county health departments.
The county health department gets it through the domestic preparedness grant or emergency preparedness grants. It was called an opioid grant. And I was sitting there during a presentation and one of the slides popped up and it said EMS EPCR, enhancing it or increasing it. So that was kind of an easy one, and then you had to get it approved. There's a lot of steps to it, but it's really not that hard. It's just a lot of minutia. But we were able to get the last 2 agencies, which were small volume agencies that didn't have the funding to do it, and enhance, increase what's going on.
Just as an aside, I went to the Eagles Conference, which was in Dallas, Texas. It's out for medical directors throughout the country, and they're using electronic data for flu surveillance, narcotic opioid overdose to target where they may need to and start outreaches to the community. So if the data is there, we can use it to be proactive. We can target, people that are opioid abusers, repeat customers, for lack of a better word, and again, flu surveillance during flu season to target what's going on with that. So it's really important that we get data so we can make good healthcare decisions.
And to tag on to what Glenn said about the opioids, we've been doing that with the Counter Drug Task Force for the past almost 4 years now, and that has stretched into Catholic Charities and other support agencies, and they have been targeting Newburgh for whatever reason. It has something to do with the usage there. But they have noticed from last year to the current year a smaller number of opioid deaths reported by St. Luke's, as well as a smaller population that has been admitted for that. So apparently there is some forward progression, at least there, but it's all from the data.
Yeah, perhaps I'm saying too much about this, you're sick of hearing it, but, there's, in the last couple of years, the last 10 years ago, there's an EMS fellowship that got approved as a fellowship from an emergency medicine residency. So in the last 10 years, there's been an explosion in the number of fellowship programs across the country. As a result of that, you have tons more people doing active research in EMS, like there never was in the last 10 years. And now you're seeing, I mean, if you look at the EMS journals, there's a lot more research coming out. And this is all, like, you know, basically a huge data mine for them to pull from. And so I think we're going to see tons and tons more research because there's lots more people doing research than ever were before. And now we have big data for them to utilize. So it's all great.
To tag on to what Glenn was saying, I mean, I don't know, gotta be a dozen and a half years ago, that's what First Watch started out doing. And they aggregate data from CAD systems, from larger CAD systems, and they provide heat maps for you so that you can target, whether it be bioterrorism or a flu outbreak or an opioid overdose outbreak, stuff like that. And they can get the dispatch center the information before they even realize what's happening. That's what they started with. They're into a whole lot of other stuff now. It's all about the data.
Okay, thank you. Good discussion. Medical Director's Report. Mark?
So, to the REMAC, EPCR, medical director. The EPCR, I think we just did.
Yep.
Kim, I'd written down just what Kim said from the last REMAC meeting.
Dr. Pappas, you gotta raise your voice for me because I got lots of...
Sorry. Dave's always talking, I know. So the last REMAC, unfortunately, got hit by the weather, and so we didn't have a quorum. It was largely a discussion. There wasn't too much discussion about medicine itself, but as far as the, we were talking about the EMS summit that many of you were at, and what we discussed there. That was about half the meeting. The other main points was, one, what Kim said about the opioid, and I think our shot is currently taking applicants for auditions for the next set of BLS videos that he's going to be making. So if anybody is interested in participating in that, the ALS videos were great. So I think, when's he starting that?
They're doing that actually as of
It's March,
today.
right?
Today.
Today, tomorrow, and Friday, right? Yeah.
So you're too late.
Can't make it.
Next one, you could be on there. So, but that's great. So we're going to get more videos. And the only other thing that I remember from the REMAC I made note of was the RTAC report. We still have room for improvement, according to the RTAC, regarding destinations for pediatric trauma patients. I don't know the hard data, but the report was that while there's been improvement over time, we still have a lot of pediatric trauma patients not going to the pediatric trauma center right away. And so that's an area to bring back to your people. That's all I got.
Okay. So getting to the committee reports. Dave, training?
So we had a CLI and a CIU complete. Thanks to everybody who assisted with those classes. We're planning on just having straight CIUs every quarter, and then having a CLI in the spring and CIC in the fall is sort of our thought of doing that. So it's just on a typical schedule. Everybody knows when it is, and you can get personnel into those classes. So the next thing that's going to happen is a CIC in the fall. And we're scheduling the next CIU. So again, thanks to everybody who assisted with those. And just interject some stuff from the state related to training. The CME program update should
I'm sorry,
happen.
say that again, Dave.
The CME program update should happen by the May CMAC REMSCO meeting. Do not send anything in following that new program forms or tallies or anything like that. Keep doing the way that you've been doing it. So don't send anything in because it's on new forms. It will be sent back. The state is accepting regional faculty applications directly as opposed to going through regional offices. If you're interested, please contact Liz Donnelly at the New York State Department of Health. Leave a phone message for her. You'll need to submit a resume and letter of intent. There will now be 2 levels of CIC instructor status, a BLS instructor and an ALS instructor. The reason is that many places just want to have a BLS CIC, and they don't have the ability or option to do the extra hours at an ALS internship site, wherever. And so they're getting their BLS status, and then at some other point doing like another 7-hour update or something on what that is, and doing the extra ALS hours for the classes. So that more stuff will come out on that as the state releases it. And I think that was it for training and ed. Thanks.
Okay. And Dr. Papish, anything on the REMAC protocol, or you just covered all that? That's okay. All righty. Transportation Committee, Glenn?
Yeah, under new business, we'll have a second in motion coming up for the transfer of authority/ownership of Gardner Rescue Squad Inc. to Gardner Fire District. As I was told that this is considered a non-pro-tunc action, which is correcting a past action. I don't know what the technical term is. I was told I had to say that, so I did. That'll be under new business.
Okay. Public information, anything? Nothing from Desiree? All right. Policies and procedures. Greg, is nothing on that? Nothing? All right. Albie, legislative and bylaws.
Big stuff going on.
Big stuff.
As a reminder, everybody, on March 22nd, which is a Friday, the hours of 8:30 to, I'm not sure when, we are having our 2019 legislative breakfast. As you recall, you approved having the breakfast, and the legislative committee, as well as the region's administrative staff, have been working most diligently to put this on. The committee has met, and we have come up with 4 talking points. There were several. We know that we have many, many issues facing EMS, not only in our region, but in the state of New York. But we narrowed it down to 4 issues that we feel are very important to hopefully get our legislators to listen to. At this point, we have 6 of our legislative offices that will be represented and attending our breakfast. And hopefully, over the next week or so, we'll be able to get more in attendance. The 4 talking points basically deals with the state of EMS in our region and the state. The infamous proposal, or the proposal of our infamous governor dealing with the crossover payments that will be affecting not only commercial services, but all volunteer services that bill. That is going to be one of the talking points. Secondly, state of EMS. We will be dealing with many things under that topic. Number 1, declaring us as an essential service, which we are not at this time, dealing with the inequities of pay amongst our first responders, losing services and losing personnel in the ranks of EMTs and paramedics, and the troubles that we are facing as we move forward. Also, the continued fight in the legislature on the changes of General Municipal Law 209B. That'll be discussed. We will be discussing also the supplemental payments, which is related to crossover payments. For those of you that don't really understand what that is and how it affects you, I urge you all to support the committee's efforts and the council's administrative efforts and attend this legislative breakfast. It is going to be informative, and it, again, touches topics that affects everybody in this room. Now, where's that going to be held?
Here.
Here. Home suites, right? Registration is between 8:30 and 9. And then we will have breakfast, and then we open it up to the legislators. There's an agenda, we'll have introductions, and there'll be rules to follow. It is a non-political event. We're not going to talk politics. It is here to enlighten our legislators. You do know that this year, the Democrats have taken control of both the Assembly and the Senate. So all of the legislators that have been familiar with our EMS issues, and we've been fighting with here through our region and through the state with the Onion Brothers, it's a whole new ball of wax. And we need to educate these legislators on the problems facing EMS. And ladies and gentlemen, it is serious. And if we don't educate them and educate ourselves and get energy flowing from this body too, EMS in the very near future in this region is going to be in decline. We know it, we see it, but it takes the leaders in this room to address it. So I urge you please to support us and attend the breakfast, and any other people that are in your respective squads and agencies, please attend. It will be very informative.
Along those lines, you guys were elected by your counties, appointed by your counties to be the delegates here. You're the leaders. You need to go back to your counties and push this meeting, get your county legislatures, your town supervisors involved. We've got to get the message out, not just to the state folks. This is a town, county, region, state problem. Everybody here, yeah, Albie and his committee has done a good job about it, but, you know, we need representatives from townships and counties there too, not just the state folks. So if you've got any influence with your local elected officials, invite them to it. Let the office know so we can make sure we got the right accommodations for them, but you're the EMS leaders in this region. It's up to you guys.
It's the Assembly and the Senate that changes rules and makes law. It's your local town boards, it's your supervisors that are facing these problems within their townships. And there's no reason why you cannot invite them to this legislative breakfast. Because not only will it help them, but they too have the avenue to talk to the state and the state representatives. So if you have it, this is your responsibility as delegates. Reach out to your community and reach out to our legislators and local town officials and village officials and let them know what's going on in EMS. You're elected to be here. It is your responsibility, and we urge you to take that responsibility seriously.
Thank you. Anything else? Sorry, Tim, go ahead.
To Albie and to the group, I've been told within the past 24 hours by Senator Schmidt and by Senator Skoufis that each of the one-house bills have the crossovers reinstated. Those are just one-house bills. They have to be negotiated with the governor. So that's a step in the right direction. We're not there yet, but through the efforts of the legislative committee here, and this board, and REMSCO, and Onion, and Nispera, and everybody that's been testifying and speaking with legislators over the past month and a half or so, that we're really making some progress. However, nothing's been said yet about the supplements, and nothing's been said yet about the Medicaid rate either. So, you know, I'm always, I like to be a glasses half full kind of guy, but I don't know what that's going to happen, what's going to happen with those other issues.
And although the state legislature, Assembly and Senate, has passed that, the bill, the governor, I'll tell you, there's going to be a fight between the governor and our state legislature on this. And that's why it's important that we as delegates reach out, write letters, call the office, have your town officials call, write letters. It has to be done now. The budget is being met the 1st of April. Rumor has it might be extended because of the fight. But it has to be in by the 1st of April. It's not look as though it's pushed down the road. Reach out and get people to start calling your legislators before the 1st of April.
Just as a housekeeping item, if anybody is planning on going to the legislative breakfast and hasn't signed up yet, please do that so that we can keep track of the head counts. Okay? We want to have enough food for everybody.
Mr. President, may I take this opportunity as a legislative guy to talk about mutual aid, or would you like it under whole business?
No, go for it. Mutual aid is, just keep going.
To refresh everybody's recollection, we have a tag committee here addressing the issue of mutual aid as it relates to policy number 12-06 that came down from state EMS. Several meetings ago, I told the body that it will be the last report that I make until I get some resolve from somebody. I have dealt with counsel party at the state level on the mutual aid and the effects that 1206 should have. I dealt with Mr. Greenberg, and I have dealt with him as recently as, let's say, a month ago on mutual aid, and with our state representative, Mr. Wendt, who was also involved dealing with Mr. Greenberg. At the last REMSCO meeting, mutual aid was brought up on the floor. The answer that I got from Mr. Greenberg and from Mr. Wendt is that REMSCO, our body, has the authority to address mutual aid. We have the authority and the responsibility to address mutual aid. This body approves mutual aid plans that are given to us from the county coordinators. 1206 is a policy that comes down to explain Article 30. It's like an amendment to any constitution. I am told that this body has the authority to approve mutual aid and has the authority to follow the policies that are brought down from the state level under Article 30. So, if 1206 is clear, I would ask that administration review 1206, make sure that the counties have submitted their mutual aid plans as they are supposed to here, and as they're supposed to be approved by our body. And once that's done, I'm sure that 1206 will be followed. Until then, I am exhausted over this subject, and I'm now leaning on administration to move forward and doing what our responsibility is. If anyone needs a copy of 12-06, so that you understand what it is, I have it with me. We can run copies, and you can take it with you. It is clear as a bell.
1206, if you actually open it up, there's an attachment to it. It's like a worksheet in the back. It's a matter of filling it out. We did it in Rockland a few years ago. Once a year, we ask if they want to make any modifications to the region. So we went through the whole channel. But a sidebar to that is when Hurricane Sandy hit, one of my agencies that didn't participate at the time almost got caught by the feds, and they received FEMA money. Because the people from FEMA wanted to see that mutual aid plan. They weren't participating in it. We helped them out, and we got them through the hump so they didn't have to return the money that they had received for being a shelter and some of the damages that occurred. But don't wait for the disaster to find out how important it is. I've preached it, up into reporting, and I was afraid of it too. But open up the policy statement, scan to the bottom 4 pages. It's a matter of a sheet that gets filled out by the agency with things naming who's authorized to operate, what their response time is, or their expected response time is. That then gets turned into the coordinator. The coordinator reviews it to make sure it's valid. They sign off on it. They submit it to the region. It's a step-ladder approach. It's really not that hard. I did most of the typing myself. I verified who had authorization to operate in the area. We named all the different agencies. And understanding, like in Rockland, we have 5 agencies that are commercial that can operate in our county. It's not practical for them to respond because they're not located in the county, so a notation was made, but they were all listed. So don't be afraid of it. It's not really that hard. It just takes somebody that has a little patience.
And your program, yours is a county-wide, not an individual organization?
All agencies are signed off on it.
Yeah, so it's a county, yep.
For one
Yeah.
thing.
So it can be a
That's what we
county,
did.
it doesn't
We
have to
did-
be
we did the
individual
whole
agency.
thing, and then what I did was I filled it out for each agency based on the information I had. I got copies of the certificates to make sure I had the right response area listed and everything, and then I gave it to the agency. I didn't put down what I expected their response time to be, how many minutes, because it's like a generic thing, it's kind of a form fill thing. So I didn't tell anybody what their time was, I gave it to them, said fill in the blanks or change what you need. I mean, if you don't agree with what I put down. But I went straight by data. I mean, I went and got, obviously, there's certificates of, that they were operating under to make sure I had the right verbiage down.
Tim, correct me if I'm wrong, you also got an affirmation from each agency to participate in this plan. So,
Well, that's part of it. They have to sign it to bring it forward. So again, it wasn't that hard, but it saved one of the agencies a whole lot of money, a whole lot of headache.
Which counties do we have mutual aid plans for? Which ones do we not? And what are the dates?
We have mutual aid plans for all the counties. Some of them are very, very old, as more as 15 years old, but I do have a copy of it. Rockland County is the only county I have that has the new format of the 0606.
Thank you. Question regarding, you just made a point, what about counties doing mutual aid to other counties? Meaning, if there was a situation that, I don't know, whatever, tornado comes to Orange County, wrecks a whole bunch of agencies and they can't respond. We now, either they call it ambulance plan or whatever they come.
Once we get into that, we go to the state mutual aid, which
Okay.
there's a whole policy for that. So we make a request through Albany and they would allocate what resources come down. When we go outside the county. Because we also have the unique piece of having New Jersey on board, if Jersey
Right.
doesn't want to play nice, so.
Of course not.
So, but again, it's not that hard, it's a little time consuming, but if you have somebody that has some patience, they can do the research and fill it out for people, it's really not that hard. And to be safe, just to make sure we're covered.
Yep. Albie?
The original tag committee for mutual aid was Mr. Lamarca and myself, and he has since retired. I would ask that we expand the mutual aid tag committee of the council so that we can work with administration on how we move forward with updating the mutual aid plans and also to follow 12-06 in its legal entirety.
Have any volunteers interested in working with Albie?
I love you too.
I believe we have somebody from each county,
I'm sorry.
didn't we originally have somebody from each county represented?
It was supposed to be each coordinator was supposed to be part of
Or the
that.
coordinator or their designee.
Or yeah.
Nick was doing it, Nick was doing it.
Yeah.
The way it was set up, it was Andy and myself, and in our first mutual aid tag committee meeting, we had the EMS coordinators from the 6 counties, the 911 coordinators from most of the counties, our staff. I think that was it. And we did discuss all of these things. And as a result, we needed to get more legal involvement, and that's how I reached out to Council Tardy at the state level to get things moving, which did not move quickly enough and to finalization until now. So I would ask that we expand ourselves here. I need a couple of people to help. I'd like to have at least 3 or 4.
Great.
So we
Tim,
can
did you?
help-
Okay.
So we can help you administrators move this along.
All right, I have Dave and Tim. Anybody else?
Nick was ours, I mean, unless he isn't anymore, he's not here to speak for himself.
Who said that?
I said that Nick.
No, I'm sorry.
Israel
I'm
Howard.
sorry.
All right, Tim, Israel, and who else?
I have Dave, Tim, and Israel, and
Thank you.
And just to clarify, that's Dave Grass.
oh no, I put Dave V. Yes, I got Dave G. Thank
You
you.
don't have enough to do?
No,
It doesn't cover all of our counties. If we want
yeah,
to-
but again, it's not all of the counties, but at least we'll get it started and see if we can get the coordinators and 911 folks back involved in it. All right, thanks for your work on that.
Yes, sir.
All right, community paramedicine, we have that on our agenda item. Should we keep carrying that, or? Tim,
I
you're,
see Bill and Rich both staring right at me.
yeah, well, no, you're the one that's doing this, so that's why I looked at you.
Well, I mean,
It's actually
I mean, I don't know how you want to handle it from a community perspective, but we're running a program. We just got funded for the second year for the first program, and we're going to be
Tim,
starting
you gotta
another-
slow down for me. Too fast.
Sorry.
That's okay.
We just finished our first year of our first program. We got funded for a second year for that program, and we're starting another program mirroring the first program on the other side of the county. We're going to be presenting on that program along with our medical director, Dr. Rayrich, down at the Community Paramedicine Conference at Mount Sinai on, I believe, the 29th.
There's one
There's
there
a
coming up.
Community
yeah.
Paramedicine Conference down at Mount Sinai. I could send the link to Karen so that she could send it out to everybody if you like.
Mhm.
We'll be presenting the results of our program there, but it was quite successful.
And where is it, the state level? Do you know?
Well, that's a whole different story.
I think that's where Mike was, when he was presenting on it, was the
I
state,
see.
Evolution.
the
It
state
is,
stuff.
honestly, in my legislative and personal opinion, I think we've taken a step or two backwards, simply because Health Committee Chair changed in the Senate. Senator Gottfried has gotten it nowhere. It's not made it out of committee in the Assembly. It doesn't look like it's going to anytime soon. The governor keeps putting it in his budget, with the swing in the Senate this year. I don't even think it's on anybody's radar this year.
So should we continue to follow it?
I think we should. Quite
Okay.
frankly,
Yeah.
I think it's the future of.
Health systems
Oh,
are
absolutely.
very interested. My health systems, I mean, they're talking to you guys.
Yeah, absolutely. I mean, I honestly, I think we should continue to talk about it, because if we let it go away, it's going to become a non-issue, and it's going to be very isolated in different parts of the state. But I can tell you that I presented on our program at the State District Conference in Saratoga Springs last month, a few weeks ago at the Population Health Summit up in Albany, presenting at the CP Conference down in Mount Sinai at the end of the month. So we talk about it all the time. We're always willing to talk to different programs. I get a lot of questions from across the state. So we're very active in it, and we're keeping it within the confines of Article 30, of course, but obviously we're interested in expanding it beyond Article 30 once it's legislatively approved, and as is everyone else, because treat and release is the future of EMS. That's what's going to be happening, folks, and we need to figure out how to get this done.
Any questions on it? Thanks for your input, Tim.
Yeah, that's all.
All right, EMS Council, you got anything else, Dave? I think you pretty much,
Yes, there's a good amount of stuff here.
Okay.
The state's looking at a statewide QA/QI process that'll include specific metrics and key performance indicators. They've developed a committee to rewrite the QA manual for agencies, so that's being rolled out. For anybody that had a check and inject device recall, it wasn't other than a syringe component of the delivery system where there was a problem. That was corrected, and those things that were recalled were resent out with the correct information and components. They had a large discussion about the transfer of care process among providers to any other provider. They're looking at a specific statewide process that could include the MIST format, which of course we currently use, and they'll develop something along those lines. They did talk about the BLS protocols a lot, and they're looking for an implementation date around August 1st, and of course the information that Bill had provided on their scans, of course. This is the first time I think they've been changed in something like 17 years, so this is just, some amazing stuff that's coming through there. It's great. A couple of notes are that the BLS protocols match exactly the BLS portion of the collaborative protocols, so there's no longer any difference among those for the BLS components. They're not considered operational documents, they're considered clinical guidelines. So to that end, wherever in the protocols you see the words "if equipped and trained," that means that those items are regional options. And so it's not something that you have to do. If you're equipped for it, fantastic. There's a few other things in there. They did talk a lot about the transport of pediatric traumas to pediatric trauma centers if trauma center is less than 60 minutes away as a component of that. So a lot of good stuff in there. Stroke centers will have new designations in the next 2 to 3 years based on accreditation by a variety of accrediting bodies. So that will be rolled out by the state. Those new designations will be primary stroke center, thrombolectomy center, and stroke-capable center. We talked about the 17 years of age, CME program, electronic stuff. There's a new pediatric care coordinator committee that is working on improving pediatric training, equipment use, etc. I ended up being the rep for the Hudson Valley region. That doesn't mean I'm putting on all the training or providing all the equipment. That means that I get to help coordinate agencies to have a pediatric care coordinator in their agency. So we've already had a couple agencies in the region come on board with a pediatric care coordinator. That person doesn't have to do the training and all that stuff. They have to just coordinate pediatric activities such that training comes in, that they advocate for pediatric equipment, that they follow pediatric guidelines, things like that. So please have somebody at your agency be a pediatric care coordinator. You can email the region, you can email me, we'll get the information out to you. Signing up is really easy and there's a lot of resources that are coming out from this program. If you don't have one, I'll keep talking about this until everybody does. So.
Dave, can it be shared between agencies?
It can.
Yes.
Yes.
Absolutely it can, yes. Yep. But I will also have the option of emailing and calling people, so if you don't want to hear from me, let me know that you're going to be the pediatric care coordinator for you or your surrounding agencies. That would be fantastic. Okay. Vital Signs Conference is in Buffalo this year, October 24th to 27th. EMS Week is May 19th, and the EMS Memorial is May 21st. The DOH is going to be sending out a quarterly newsletter. It now has a Facebook group called the New York State Health Department EMS Community. Not to be outdone by the protocol group, the Systems Committee has begun revising Part 800 requirements to modernize them, and they are definitely looking at throwing out a lot of things that we don't need, modernizing some of the nomenclature so that we have the appropriate equipment in the ambulances. So more to come on that.
An example, Part 800 still calls for sandbags.
Yeah. Right.
I was going to say, do they still have bite blocks in there too?
They might.
Yeah, those are some of the first things to fall off of the cart. If you haven't looked at AT&T's FirstNet system, take a look. It gives first responders priority communications on cell towers. They give responders reduced rates as well. So take a look at that system. It's called FirstNet. You have to go to an office, you have to bring your ID with you. Signing up is fairly easy, and you'll have priority communications. There's a ton of discussion about EMS being an essential service, what that would mean, what it would look like, and some of the constraints that are happening, mostly on the federal side. It's a huge issue that we've talked about here. I'll talk about a little bit later with the EMS Summit. And they're continuing those discussions at the state level. And again, thank you tons to Albie and Kim about the mutual aid policies in place, and that the REMSCO most definitely has the ability to review those by law and should. So there was a lot of discussion about that as well. And I believe that's the nuts and bolts of the next episode. The next one is in May.
Yeah. Any questions of Dave? If not, let's see. Okay, old business, transfer of internal funds policy. Do we have that for review or nothing? All right, awards committee, written policy and procedure. Do we have anything on that?
Karen just handed me some stuff we were drawing up. I'm going to be on a phone call tomorrow. I'm going to get some more information to make it a straight policy. But if anybody hasn't done the awards yet, or submitted awards, just a reminder, each county is allowed to submit ones for each of the 9 categories, awards categories. The information's on the regional website, it's due to the region April 1st. There's a form that has to be used, and it should be submitted digitally, because it has to go on from there to save some time and clarification on it. I've been doing this for a lot of years, and I can tell you on a regional level, on a county level, it's embarrassing how few applications come in. And on a regional level, not every county submits anybody. It doesn't mean that you have to submit for your organization. If you were working well with another organization, you know, the doctors and nurses obviously aren't in the EMS agencies for the most part, they could be in the hospital. It's 1 page, or 2 pages with the cover sheet. It's not a lot of information, and it's embarrassing, because again, on a county level, it's poor, I have to go, that's what I'm focusing my energy on right now. The regional level, it's poor, on the state level, it's poor. Whereas many regions are out there. So, in the past, I know in this region, we've had stuff handed in on cocktail napkins, you know, scribbled out. Just take the time to do it right. The form is there. It's supposed to be 12-point font. You don't have to write a whole lot. It's like 2 paragraphs, fills the block. And again, the deadline, I believe, I'm going to correct me if I'm wrong, April 1st for the region, because then it has to come from us, and the winners from our area are submitted to the state. And we've been very fortunate over the years in getting a lot of awards. So it's free. It doesn't cost anybody anything but a little bit of time. I know we're all busy, but that's why we can delegate and have people do it for us. We still have time. April 1st is a few weeks away. I'm working on rocking this out. The deadline was already 2 weeks ago. Please, because we have to recognize our own. Half our problem with the essential service is we don't take care of ourselves.
We've got to blow our own horn. We really do. We have to blow our own horn, because nobody's gonna give us anything. We have to make it to the
This is
point.
how we get recognition, because we draw people in. So that's my rant for the day. On
Okay.
May 19th, the day that you're speaking, that Ryan wants us to do something that happens to be every year, the start of EMS week, we do a youth competition. We have 10 teams now. We're lucky to get sponsors, so it's no cost to the kids. And the winners can go up to Pulse Check and compete on a level. And then we give out the results of the awards, the results of the competition, and then the awards. And one thing that we did, and it doesn't cost a whole lot of money, it's like $5 a plaque, I don't know what it is right now, I haven't looked at the price on it, but I asked each agency to give me a member of the year. I don't ask them to write anything up. I don't care what this person did. I don't care if it's the neighbor that swept the front of their building. I don't care what it is, because the drivers are people that don't qualify for all the other ones, but it could be also an EMT. And just give me the person's name and their email, or a way to contact them to invite them to the awards. And then we give them a plaque saying Rockland County and Havister Ambulance recognized as member of the year. It's a $5 plaque. It's not a lot, but it means something to people. And it brings people in, because typically before, people didn't win awards, or their agency didn't have any awards, they didn't want to show up. But it brings people in. So again, toot our own horn, let's get some information out there, some recognition out there for us, and do it right.
Have you put together the review committee for the award yet?
We usually get somebody from each county we ask. And
Okay.
That's not saying everybody participates, so.
Mhm. Okay, so
Yeah.
you'll take
And
it.
what I'm gonna do, because Karen had given me some guidance here, I'm not gonna bore everybody with all I kind of summarized it all, but the state has a certain way of grading them, because I also evaluate them on the state level, so I'm gonna try and use that, mimic that here, because every year we kind of go over it, and we're trying to make sure we're doing the right thing, so let's be consistent. How I do it on the county level is I give them to somebody, I redact the names, and I give it to somebody that has no idea who these people are and doesn't even know EMS, and just say, here's a description, here's a write-up, tell me how you rank them.
Okay. Anything else? That's it? All right, new business, EMS Summit. Dave, you want to hit the highlights of that, or?
Sure, be happy to. A couple of weeks ago, we had an EMS summit. A lot of you were there. Thank you for that. And the point of it was to get our group together to come up with what our main issues and problems in EMS were among agency types, and then what our potential solutions were, and then sort of a what's next. And so we had 80 some odd people that attended from all around the region. So kudos and thanks to all the agencies. We had every single county represented, and we had every agency type within those counties represented as well. So, and kudos seriously to Albie, who was there, because it sounds like from the legislative breakfast component, their top pieces are things that we talked about as issues from a larger body and a larger group, which was really, truly great to see us pulling together for something for ourselves. So, top issues, problems, A, staffing and competition for staffing among agencies. Agencies stretched too thin in their own areas, let alone mutual aid, and cost increasing and reimbursement decreasing. B, misuse of EMS. EMS not seen as an essential service and lack of advocacy, and there needs to be education and leadership training within agencies. C, transparency among agencies and their communities, communications internally and externally, and too much dependency on ALS. Those were the top 3 areas and issues and problems. To solutions, and this is a summarization. There's a huge whole table and chart that we did outlining every group's pros and cons and things. Solutions, A, communication with the public and lobbying of officials. To quote a person at the meeting there who's here tonight, go to meetings. Go to meetings. Go to your county meetings, go to your regional meetings, go to your town board meetings. Not when you have a problem, just go all the time. Let them know who you are, that you're there, what you're doing, how many calls you did, whatever, so that when they know you and see you and can ask questions, all that stuff comes out, and that helps with the transparency. And then when you do have an issue, and you go to them and say, hey, we need X, Y, Z, they'll look at you and say, who are you again? They know what's going on. They're informed and can help you. So go to your local meetings. It is really important to interface with officials ahead of time. Using data and analytics is a solution to providing funding and staffing needs, and then agency collaboration and transparency. So working as a system in an economy of scale. Part B to solutions, finance, finance, finance. We're not an essential service. We're considered a different service if you ask the mayor of New York City. We should have preferred provider status in specific funding districts and things like that. And we need to change Medicare and Medicaid rates and PAC funding and pay wages. So it really does come down to money. If we don't have money, we don't have people. If we don't have people, then we're not doing the community any service whatsoever. Part C for solutions was education within agencies, including succession planning and educating communities to what's going on. Using PSAPs to filter calls better and not utilize ALS as often, using the right resources for the right calls. Better unity in the system, make EMS a career. There was discussion of EMS authorities in areas and EMS academies in areas. So those were all the solutions. So what's next? We did form a committee to start working on these solutions. We all need to be accountable and responsible. We have to make a change for us. Someone else isn't going to do it. And so if we don't do it, someone else will. And we may not like the change that they make. We need to continue to do analyses. And then, of course, work at the legislative breakfast and then up at Legislative Day in Albany. And continue to work on this as a larger group, not just individual little pockets here and there with our own little ideas of what we want as individual agencies. We're not going to get anywhere. And so it was very, very successful. We did get feedback from a large contingency that said we should have some in the evenings as well. I agree to that. But there was a large group of volunteers there for a daytime program that we did, and it was really nice to see everybody working together at this summit. So thanks to everybody involved in putting this on and doing it.
Dave, how many people signed up for the committee, the follow-on committee?
20 some odd people.
Okay, when will we be hearing?
As soon as we get the final points in from the groups as to what their top numbers were, we get the spreadsheet done, sent out, we can send stuff out to the committee.
Thank you.
Yep.
This was perhaps one of the finest forums I think I ever attended regarding EMS. Dave organized it and presented it so professionally. It was such a success. I commend you.
Thank you so much.
Yeah, good job.
It was truly a lot of work by a lot of people, so thank you to everybody involved.
Okay, that is what I have left on the agenda. Yeah, on the new business, thank you, that's not on here, all right?
You just did the Hudson Valley Senior Summit, that's in new business.
Yes, but it's not under my, go.
All right, so we have a second motion regarding the transfer from the Gardner Rescue Squad Inc. to the Gardner Fire District. Apparently, they've been working with Dana Jonas at the Health Department regarding this transfer. We met through a phone or an email poll, and we feel that their fitness and competency is okay. We believe it is a non-pro-tunc action, correcting the bad practice. Essentially, it's being transferred to a municipal governmental agency, a fire district, and therefore it's considered NUNC pro-tunc action.
There are very specific rules on how that can be used, and we had to sit down with the state and go over that to make sure that this particular TOA fell into that. And two people in the back of the room who are responsible for that and spent a lot of time working on getting that paperwork that they needed in order. They've probably been working on this over 18 months to get it, just to change over the ownership or the name on the certificate for the service that they have been performing for the last 25 years. So I don't know if there's questions or anything, but if not, we can move to a vote. It's a seconded motion coming from the Transportation Committee.
Okay, we have a second motion on the floor. Any additional comments, discussion on it? If not, it's a second motion. All in favor? It does have to be a roll call vote?
I believe it does.
Okay. And Tim, as the third, you can vote. Okay?
Is it the big boy table?
Yeah, you could have sat up here if you wanted to. The other Tim. Go ahead.
Okay. Nicholas Trio, yes? Dave Violante?
Yes.
Dee Sagendorf?
Yes.
Guy Carpico?
Yes.
Ben Conquest?
Yes.
David Grass?
Yes.
Israel Knobloch?
Yes.
Robert Cuomo?
Yes.
Kim Lippis?
Yes.
Tim Egan?
Yes.
Glenn Albin?
Yes.
Teresa Hamilton?
Yes.
And BJ Leidner?
Yes.
Albie Bachman?
Yes.
Neil Meadow?
Yes.
Richard Parrish?
Yes.
Kelly Nelson?
Yes.
Timothy Mitchell?
Yes.
Did I miss anyone? We have a unanimous yes, Mr. President.
Thank you. All right. Any other new business? If not, go ahead.
Just a few quick things, quick reminders. We mentioned the EMS Memorial before. It's on the Empire State Plaza on May 21st at 11 a.m. If you are going to bring a vehicle, you have to register the vehicle first with the state, and the vehicle has to be in place by 10 o'clock in the morning, if anybody is going to be doing that. Right? Just so you're aware. The other thing is, Pulse Check is coming up shortly, just so that you know, it is September 12th through the 15th in the Crown Plaza in Suffern, if you're interested in that. And I think that's all I had. Everything else was covered.
Yes, Terry?
Okay, New York State Volunteer Ambulance Rescue Association's Legislative Day will be May 6th, obviously in Albany. Please feel free to reach out to our legislative committee at legislation@nisbara.org, or myself, and I can guide you and lead you where you need to
It's
be.
a worthwhile day. There's not that many people that actually go up, but again, that's our presence. If there's only 10 people going up, they think that's not an issue. They do get appointments with each of the different representatives that are willing to sit down, and they go to the table with them and they can discuss issues.
And if there's anyone that you guys want us to make appointments to go and see, we'll be more than happy to have the committee try to reach out and make the appointment, or you can make the appointment and let us know who it is and what time.
Anything else? If not, I need a... No, I said, wait a minute, all right? I need a nominating committee. All right?
Looks like two people that signed up for the nomination.
Yeah, tell I to take those two. All right? So,
I think I was on it last year.
you did it?
I think it was on it last
Yes, you were.
You gonna do it again?
Sure.
All right?
You need one from every county.
It should be one from each county.
It's required to be one from each county from our bylaws.
So
we need
D.
at least a representative from every county.
Come on, guys. One from each county. Dee's got Duchess.
I'll do Rockland.
I missed whoever said, was that Neil?
No, Glenn.
No, no.
You heard my laugh.
Somebody down there said I'll do.
Neil.
Neil Meadow.
Neil?
Neil from Sullivan.
Neil Meadow, Sullivan County.
What?
Is it a deal that I'm the only one from Putnam here?
Is
Just
that
so
it?
happens to work out that way.
It's either you or you can get someone, you can delegate someone.
Right.
Just remember that, it doesn't have to be you.
Oh, that's true.
Yes, let's go, delegate.
Hey, come on, you have all this time off now.
Who's not here?
Yeah. What's that?
Who's not here?
Oh, yeah, I nominate them, no.
Yeah.
So you gonna do it, Bob?
Yeah,
Okay.
sure, why not?
All right, so, anybody else from Ulster and Orange?
I'll do it for
Ulster, okay.
Is that Kelly?
Kelly.
Okay.
All right, so we just need somebody from Orange? Anybody from Orange?
All right.
That's David DeGrasse.
For the record, it's David Grass.
Yeah,
Yeah.
all right. Orange, Rock, and Silent. Yeah, that's it, 6.
What's the sixth one?
I've got Dee, Glenn, Neil, Bob Cuomo, Kelly, and Dave Grass.
Okay.
All right?
I didn't hear Bob jump up and down.
No, okay.
I wasn't jumping up and down for joy, but I was doing it, yeah.
All right.
The answer is teleconference.
Yeah.
Yeah, we can do that.
That's
One of
better.
these.
We're
Yeah.
good at email.
Dee, do you want to be the chair of that?
No,
No?
no, not this year.
All right.
Somebody else do it this year.
Who? Somebody else?
Somebody else do it.
Okay. Yeah, you chaired it last year, right?
Yeah.
Yep. All right, anybody, do I have to appoint somebody? Is out of the 6, somebody want to be the chair?
I'm looking that way.
Don't look at me.
Yeah. Somebody's got a chair.
Yeah. You know what's going on, why don't you do it?
Is this my way of making sure I don't get nominated for vice president again?
That's your call, it's your call. Okay?
You're gonna be the chair, Bob?
Sure.
By default?
All righty. Thank you. Then now the motion's in order.
Motion to adjourn.
Second.
Thanks, guys.